Hello and happy Friday. Today's video I will cover two very important details in regards to the human frame for the standing posture and the seated posture. This video goes out to a very special friend of ours, Mrs. Chelsea. In regards to the standing position, if you have worked with me directly in the office, and let's be frank, if you have been a student of mine in any of my anatomy and physiology classes, you have heard me say, sit up straight or check your triangles. So this is an easy way to remember how we should stand to avoid pain or mechanical joint problems in regards to the human body. If we stand with our feet shoulder width apart, and we have the belly button as a reference point, feet shoulder width apart and the belly button, we then would have a bottom triangle. For the top triangle, you would say the shoulders. Essentially, we are two triangles stacked up on top of each other. This being a very weak area in reference to the triangles, pulling our belly button in, what people call suck the gut in or contract the abdominals, helps to stabilize this, which protects your lumbar spine and helps each of the joints, feet, ankles, knees, and hips sustain and maintain about 50% of your body weight in the standing position. If you wind up being one of those tilty side triangle people, you'll find that all of your weight would go to one hip, one knee, and you'll often see the right side hip and knee go into degeneration or injuries needing repairs in a larger group setting. So if you hear me say check your triangles, I want you to think about this standing posture technique for protecting your spine and your lower extremities. And let's be honest, this looks much better than this. In regards to the seating posture or the seated position, we can't always maintain those perfect triangles. Sometimes we get fatigued and it's easy to tilt. Sometimes we're short and our feet are dangling. How would we correct in the seated position? Typically, the body will provide a little bit of support by bending one knee over another. The primary reason I would recommend you do not do this is it rotates or causes pelvic issues. It most commonly will cause damage to the knee joint that really only has two ranges of motion, straight and bent. So this would compromise the knee, the pelvis, and the back, and we really just need to put something under our feet here. I would get up in any kind of office setting. I would find a chair that fits me better, or I would grab something I can put under my feet and correct that. My knees are slightly higher than my hips. That supports me in the seated position. My abdominals, or triangles if you will, are back to neutral, and that right there is perfect seated posture. We'll see you next week for another great video. Have a great day and watch that posture.